Welcome to MDI Hospital's Community Town Hall and Forum. I'm Christina Maguire, the President and CEO of Mount Desert Island Hospital and Health Centers, and I thank you for joining us today to discuss what we would hope we would not be discussing a year from last year, but the COVID-19 pandemic. We're going to talk about vaccinations, variants, and ongoing mitigation strategies, as well as the Omicron variant, which continues to increase cases and hospitalizations throughout the state of Maine, throughout the nation, and how we're going to be calling on you as part of our community to help persevere through another level of pandemic, which includes pandemic fatigue and fluxing, and it's really important to maintain those critical safety precautions. We're also calling on our dedicated business partners to join us once again with helping to lead the community by masking, reinforcing critical precautions, as the town of Bar Harbor did a few weeks ago with accepting a resolution encouraging everyone to mask up. Vaccination and boosters, masking and distancing still are the #1 mitigation strategy that we can suggest to you. And avoiding large gatherings, crowded situations, and continue to be on your best defense of taking care of yourselves and self-care. Now more than ever, this time of the year, when we can be sheltered, we need to make sure that we remain healthy, because there's other viruses besides COVID that spike this time of year. These safe, effective strategies work, and we know that together we can begin to reverse this troubling trend in our region. And today we're going to speak about that. I'm joined today by two of my colleagues who you all are very familiar with. They have been involved in these dialogues and these town forums for almost 2 years now. Dr. Trevor Casey and Dr. J.R. Krevans. Dr. Trevor Casey is our Vice President of Innovation and Experience at Mount Desert Island Hospital. Trevor has taken a lead role in all of our vaccination efforts and administration throughout this community and our hospital. He leads an interdisciplinary team of physicians, pharmacists, nurse, geriatric care providers, and infection control specialists as we navigate these uncharted waters. And Dr. J.R. Krevans is the chair of our Infection Control Committee at Mount Desert Island Hospital and has been a guiding force and resource for our COVID-19 preparedness and response. He has an extensive background in public health, emergency preparedness, and the management of infectious disease. So today we're here to answer your questions. Some have submitted them in advance, which we're very happy about, and share our information and our learnings about vaccines, about boosters, and maybe a little bit of crystal balling, although what we know is our crystal balls crack really fast. Science changes and we adapt with the science. Some of your questions can be submitted today through our question and answer feature, which is located at the bottom of your Zoom panel. It's called the Q&A. We will answer as many questions as possible, time permitting, and those that we do not get to, we promise we will follow up and add them to our frequently asked questions section on our mdihospital.org website under our Coronavirus Hub. And now please join me in welcoming our moderator today, Molly Moon, who will facilitate today's discussion. It's Molly.
Thanks, Chrissy. Our first question for today is for JR. JR, what is the Omicron variant and how is it affecting COVID-19 case rates on MDI?
So a variant is when the virus has changed its genome so that the daughter viruses, we always say daughter viruses, never son viruses. So the daughter viruses are somewhat different than the parent that we're used to. It's a mutation. And the Omicron variant is different in a couple of ways. One of which is it is more contagious, meaning it takes a less dose of it to infect a person. And it spreads more easily, probably because it concentrates much more in the upper airways, the mouth and the nose. It's different in another way in that the surface of the virus feels different to the body, which sounds like a very strange thing to say, but that's how your body recognizes things with antibodies, is by how they feel, not how they look. And because it feels a little bit different, your body doesn't recognize it as well. So previous immunity to the variants that came before, the initial alpha type, the Delta variant, and does not give a complete or particularly good immunity to the Omicron variant. It gives some partial protection, but not as much. So the variant is both more contagious in that there's more of it in the upper airways and you catch it more easily, and it's harder for your body to detect. And that's true, especially if you have some degree of immunity from prior infection, and it's still a little bit true if you've had vaccination, especially if your vaccination is not boosted. So the case rates locally are very high. Basically, we're seeing more cases in Maine than we've ever seen with the Omicron spike. We actually don't really know the actual case rate, but to be honest, we're not following case rates as closely as we used to in the past because they aren't as good a determination of what we need to do. A lot of people are not getting tested at all, and many people are just getting tested with a home test. I talk to people every day who have gotten a home test that's positive, and those don't get reported into the state case numbers. We do know that most businesses, the hospital itself is included, are having multiple employees out sick at once every day, which is new for us in this area. We have not had extensive problems with people being unable to work during the previous waves. So it's here, there's lots of it, partly because the fact that our bodies don't recognize it as well, partly because the virus itself is intrinsically more contagious, and to be honest, partly because we are not doing all the same things that we did in the past year as carefully and consistently as far as preventing the spread of the virus.
Thanks, JR. Chrissy, our second question is for you. What are the current hospitalization rates in our region, and how do we reverse this trend?
Well, there goes that crystal ball again, Molly. So we always are very collaborative and lucky that Northern Light Eastern Maine actually shares an infographic with us and allows it to share it with all of you on our forum today. And what we know is in the state of Maine, we have 358 hospitalizations due to COVID. That is down from a high of last week of around 430 hospitalizations. The key factors there are still 87 individuals in critical care, and 34 of them require ventilators to breathe. The state of Maine is a very rural state. It has rural hospitals, which are the backbone of how care is delivered. And then we have 3 to 4 main large tertiary hospitals. And so this infographic here shows what is happening within the Northern Light system. And the Northern Light system is mostly in the northern part of state, north of Augusta, with one hospital in Portland, Mercy Hospital, but it gives you a flavor of what is happening with hospitalizations currently. And so in hospitalized throughout the Northern Light system right now are 116 total, 56 vaccinated, 60 unvaccinated. And so let's spread that over to our region. At MDI, we have seen our highest hospitalization rate of 6. And typically we average about 1 hospitalization per week. So we are not seeing entrenched hospitalizations because individuals who need to be on a ventilator, we actually prefer them to be in a tertiary center such as Eastern Maine Medical Center. When you look at those hospitalizations, it's interesting because under 50 versus over 50, and those over 60. So over 60, there obviously the disease has a larger impact on. And in the ICU, there are 18 individuals in the ICU, 11 of them are unvaccinated. When you further look at that information, 8 are on ventilators and 6 of them are unvaccinated. So as you think about this disease and you think about the impact, the majority of the information that's shared with us from the main CDC and with our hospital peers are individuals who have comorbidities or chronic conditions are impacted by COVID, whether they're boosters and vaccination status. And if they are unvaccinated, they have a much higher chance of being in a critical care bed or on a ventilator. So what we know is working. So if you want to take that down, Molly, I'll just speak to what we know is working. What we do know is that if you are current with your vaccine series, and yes, we changed nomenclature and we changed the way we identify whether you're vaccinated, unvaccinated, or boosted. We are now really looking at this like this is a vaccine series, just like when you had your mumps, measles and rubella or your DPT, you go through a series. Those who had their first series, either of Moderna, Pfizer, or Johnson & Johnson, are now mostly eligible for a booster. And to be current, you should have your booster. The most effective way to mitigate the spread of COVID is to get vaccinated and stay current with your vaccine series. And eventually JR will talk to us about the fact that there's going to be more boosters coming our way, and that will be asking you all to roll up your sleeve again with regard to that. The other piece, which is very effective on mitigating the spread, because as you can tell in that infographic we shared, people who are fully vaccinated and fully boosted are still able to contract COVID. What they most likely are able to manage that at home, and they're manage it in an outpatient setting and are not having to be hospitalized. That's the important thing about a disease, is if you are not filling up our hospital beds with something that could be prevented or mitigated through vaccine, it's really important, because we are running out of hospital beds for other things besides COVID. And many hospitals in the state of Maine are delaying elective surgeries now. They're deferring inpatient surgeries. They're looking at very limited outpatient surgeries because of the pressure that is on hospital beds in the state of Maine. So to your point, Molly, what we could do is continue to look at all of those strategies that we know work, right? We know that wearing a mask works. We know that it protects you and it protects the other person who's wearing a mask. Distancing works, and vaccines work. And that is the best way for us to look at what a pandemic that moves to an endemic could be.
Chrissy, Molly, is it okay if you pop that infographic back up and I point out something?
Sure.
So
it's okay for me, JR. Molly's got to do it, so we'll see.
Okay. So one thing I want people to really understand is what we need to avoid is people in the ICU. I mean, those people are horrendous and miserable, and that's really, and they spend very long time in the hospital, and they often die. And even if they survive, they're often crippled by the experience. And when you look at that slide, it looks like vaccination is somewhat effective, because it says there's 7 vaccinated and 11 unvaccinated. But remember, there's more than 4 vaccinated people for every unvaccinated person, adult, in this state. It's actually about 5 to 1 now for adults. So if there were 11 unvaccinated people, we would expect to see more than 50 vaccinated if the vaccine didn't make a difference. It's enormously effective. Basically, if everybody was vaccinated, you could flip it the other way, there would probably be a total of 8 or 9 people in the ICU, not 18. There would probably be a total of about 65 or 70 hospitalized as opposed to 120, 116. And actually that understates it when we talk a little bit later about availability of medications. Right now, most of the good medications are going to unvaccinated people in order to try and prevent them from dying. And that's one of the reasons we're short of medications. So the single most important thing is to be vaccinated and boosted. And I will say those numbers, most of those people who are in the hospital have not been boosted. They're just vaccinated, but did not get their booster yet. Whereas most people in the state of Maine who are eligible for a booster have not yet gotten one, which is desperately important. Because like I mentioned earlier, the Omicron is a little bit harder for your body to recognize, but that booster dose really improves the ability of the body to recognize and prevent significant illness from Omicron. If you're boosted, it's about 90+% effective. Thank you.
And I think, Molly, just to, you can take that down, but I just want to add one thing for MDI Hospital. We saw our highest rates of positivity since the pandemic started in December, and we're on track through January. We were slightly less in January for what we tested here for positives. And so we were not immune either to that spike for Omicron in our community. And what we started to see and continue to see is it impacts our schools, it impacts families, it impacts our healthcare workers, and they then have to quarantine or isolate. And that's really another important thing to note about how the health system is very fragile, and how taking care of yourself and being vaccinated and wearing a mask is important to keep us all healthy.
And JR, to dovetail what you were just saying, our next question is asking you specifically, has it been reported that Omicron causes milder illness than other variants? And if so, why are hospitalizations still on the rise?
Milder. As people who can look at my background can tell, I'm in my van right now. I have a few weeks off between shifts, so Mary and I are traveling. So a good way I'm driving through highways. So it's a good way to think about it is, if you are standing next to the highway and you get hit by a fully loaded logging truck, that's really bad. If you instead were hit by, a Ford F-150, that's not nearly as much impact, but it's still pretty bad. And Omicron is distinctly milder than SARS-CoV-2, the original virus. Understand that SARS-CoV-2 has caused more deaths more rapidly than any other virus in history, partly because there's more people. The only thing that's comparable from a viral infection was the great 1919 flu pandemic that's sometimes referred to as the Spanish flu. So to say it's milder than the original was true, but doesn't mean it's mild. There's a couple big differences. The biggest difference that says it's milder is it doesn't affect the lungs as much. However, nonetheless, it not only does it often affect the lungs and affect the upper airways terribly, just like the original SARS-CoV-2. Remember, it binds to the insides of blood vessels in the people who get seriously ill from it, causing heart attacks, strokes, kidney failure, liver failure, and blood clots, as well as terrible, terrible weakness. So it's milder, but it still can be very severe. And the reason we see so many hospitalizations is twofold. One of which is it spreads really well, so it's really common. And the fact that it's a little bit less likely to put you in the hospital if you get it if more people get it, there'll still be more people in the hospital. And the other reason why why it's spreading, besides the fact that the virus is more contagious, is that many people are choosing not to take actions to protect themselves or to keep themselves from spreading it. And some of that is really appropriate. We have to keep the schools open. Our schools have been really good about trying to do what they can, but you're still going to get spread in schools, even if people do everything they can. And some people are just, people are sick of it. I understand that. They're going to parties, they're going to games, they're gathering in bars. Many people do not wear masks at their workplaces. And more people are back to work in group settings. People are working from home less. All of those things are good and they're a good goal, but that they all do contribute to the spread. And we have to accept the fact that when we choose to do those things, we are choosing to spread it. And the final thing is that people, to a great extent, have really slowed down getting vaccinated. There was a huge push last spring, but the rate of vaccination has slowed way down, and people have chosen not to get boosted, and consequently, the virus will spread more readily.
Molly, you're on
Well,
mute.
you're on mute.
You think I'd be better at that by now. We've done
Okay.
some of these.
If we don't get to
Alright.
say it once during a Zoom, it's not normal.
Yeah, we'll get the coffee cups that say it. You're on mute.
Yeah.
So Trevor, our next question is for you. Thank you guys for helping me with that. What is the latest information on the safety of COVID-19 vaccines and boosters?
Well, they're very safe and they're very effective. We've given over 15,000 doses and haven't had a single reaction. And that's just our own personal experience. We've had a couple anxious patients, but nothing that has been associated with the medication that would be reportable. The other thing that we've seen is that Moderna and Pfizer are reporting that the booster is around 90% effective against hospitalization, and it's about 80% effective against ER visits and urgent care visits. And so we're continuing to see that the booster is really beneficial for everybody to get it. So we highly encourage that. And anybody who wants to get the booster can work with their health center, or we're holding another vaccine clinic out at the Regency. We thank everybody for doing that on February 19th. Please go on our hospital website. You can sign up for a booster. You can sign up for a first dose. We're vaccinating anybody 5 and older. We have the kids vaccines available. And so we're doing anybody that we can. So on February 19th, we'll be having a vaccine clinic out at the Regency, and please sign up and come see us and get a vaccine. Or if you can't make it there, please contact your health center and we'll get you signed up to get a vaccine, whatever that is along the line where you're at for your vaccine series, to make sure we can get you current.
Thanks, Trevor. I'm going to serve up another one for you. What are the new drugs that are available to treat COVID-19, and are they a substitute for getting the vaccine?
Well, first of all, they're not a substitute. These drugs are for when you have it, and we'd rather to keep you from getting sick. So the vaccine is still the best option. But if you do get sick and you're vaccinated or not vaccinated, there are some medications that are coming out that are effective and showing some good resources. There's actually a website where you can find some of these. And so Molly, if you can share that in the chat, I think that'd be great. That website will show you where Paxlovid, now you're gonna have to forgive me, these names are all made up. So Molnupiravir and Evusheld are available. Now you can't get those without seeing your provider. So don't just go showing up at the Walmart and Brewer and think that you're going to be able to get some Paxlovid. You're not going to be able to. You're going to have to get a prescription from your provider to get it, but at least you know where it may be available. Now, all these medications are in short supply. Paxlovid is a combination of 2 oral medications and is available at some retail pharmacies. Now, Paxlovid has many medication and drug interactions. And so if you're going to go on that, please talk to your pharmacist. Some of the interactions can be even with birth control. So we don't want issues that occur there. So please be aware if you're taking that medication to be aware of the side effects that you may not qualify for the medication based on other medications you're taking. So just be aware of that. It is about 75% effective. And so we're continuing to see that and monitor that for effectiveness. Molnupiravir doesn't have as many drug interactions, but is not nearly as effective. It's about 35% effective for preventing hospitalizations. So we're not seeing people rush out to get that and the high levels that we see other medications. We are doing and seeing, there's remdesivir is a medication that we've been using on the inpatient basis for treating people that are hospitalized with COVID-19. We're now doing 3-day outpatient treatments. We're looking at how we can do that through our organization, but Bangor is able to do this and does have availability. And so we are working with our providers to make sure if anybody needs that treatment, they can get that through Bangor to do that on an outpatient basis. So Trovimab is the monoclonal antibody that works against the Omicron variant. It's the only one we have in the state that works against it, that we can do for those that don't qualify for inpatient. But really, it's only available for those that are, at this point in time, it's only available for really the unvaccinated or highly immunocompromised. And even then, you really need to be 65 years or older to receive it. Because we have such a shortage of this medication, it's really being used sparingly on those that are at highest risk for developing severe illness. There's one other medication out there that is called Evusheld. It's a long-acting monoclonal antibody. It's showing good usage and good availability and where am I going? It's showing that it's highly effective. Sorry, but it's only available for severely immunocompromised patients. And when we talk severely, we're talking about lung transplants, small bowel transplants, somebody who's taken rituximab or other specific cancer medications. And if you have and you're in those classifications, talk to your provider. This may be a good option for you. The vaccine doesn't work as well in those groups. And so we really want to make sure that you have the opportunity to get that. We can either give that at our organization or you can get that in Bangor, but talk with your medical provider and we can get you scheduled to get that. That's not something we're going to do overnight, but it's something we can set up and provide access for. All these medications though, vaccine is definitely the best way to go. And these are coming out. We're grateful for them. We're grateful for the science that's going into them. And we hope that there's better options as we move forward.
Thank you, Trevor. And I did pop that link into the chat for anyone who would like to read more on that.
And Trevor, just to reaffirm what you said, these are primarily for individuals who are in a window, right? In a window with their diagnosis of COVID, and primarily for unvaccinated individuals at this point, right?
Yes, that is correct. It's a small window of who qualifies. Not everybody qualifies for these medications. It's really mostly those who are unvaccinated or who have severely immunocompromised diseases or take medications that cause them to be considered that.
Right. This is JR, just to clarify what they're highly indicated for people who are vaccinated and at risk.
Yes.
Okay.
But right now, we are using up our nation's entire supply on people who are unvaccinated and are therefore at high risk because they're unvaccinated, because they're in general the greatest risk. Basically, anyone over the way they are approved, and at the end of this thing, we're going to talk about what is our end game. How do we get out of this? Is when we have enough of these. Anyone over 65, even if they're vaccinated, should get these medications. Right now, we do not have the supply to do that. And that's that's our biggest issue. And if they did get these medications promptly, then the chance that they would end up in the hospital would be very, very low. But right now, we're not there.
And so our key takeaway again is the best course they are not a substitute for vaccine. They are not a substitute. They really are a stopgap measure to care for those who are unvaccinated. But our key takeaway is really the most important thing is to please get vaccinated or talk to a healthcare provider to help understand what your risks are or answer questions about hesitancy around receiving the vaccine series.
And the other thing I want to really stress is the Evusheld, which is for people who have been vaccinated, but are at risk that the vaccine won't work for them because they have a poor immune system. You should be talking now to your doctor or your PA or nurse practitioner, whoever takes care of you, and say, how do I get on the list? Because I know Northern Light is taking referrals. So as we get a greater availability, we'll go farther down the list of who, depending upon how immunosuppressed you are. And one of the easiest ways to know that is if when you got your vaccine, someone said to you, well, we're worried that this may not work very well. If you're on strong arthritis medications, if you take a lot of prednisone, and of course, if you're on cancer chemotherapy, you should be thinking about this and asking about it.
Thank you all for those clarifications. It's so important for everyone to hear. And on the note of vaccinations, our next question is for you, JR. How effective are the current vaccinations against the Omicron variant?
If you are vaccinated and boosted, it is on the order of 90+%, 90, I've seen a couple studies, 90 to 92% effective at preventing hospitalization, and close to that for preventing serious enough disease that you end up in an ER or an urgent care feeling terrible. Probably on the order, and this is a little harder to study, of 60 to 70% effective against getting sick at all and passing it on to other people. That's a little less well studied. It is quite helpful. Something we see all the time is married couples who live together where one of them gets it and the other person gets tested repeatedly, often because they have to work, and they're tested, half a dozen times over a course of 2 weeks while sharing a room with someone who is infected, and they never turn positive. And that's because they're effectively vaccinated and boosted. One thing that's interesting is Denmark, which just, despite the fact that it's got a fair amount of circulating Omicron, has released a lot of its social controls. And the reason they're able to do that is they have most of their population boosted. They have 60% boosted, while Maine, which is about the highest in the country, has 40% of our population boosted, and the United States as a whole only 25%. In Denmark, where 2.5 times as many people are boosted as our country, they're able to tolerate a lot of circulating virus without filling up their ICUs, and that's why.
Thank you, JR. And our next question, you were leading into boosters. Both JR and Trevor, can you both talk about if you expect to see a 4th dose of a booster approved in the near future? And what about vaccines for children under 5 years of age?
Well, there's a new study that JR will talk to us about, but the science is kind of mixed, but overall, I do expect we will see another booster down the road. But it's not yet. They haven't, and really we'll be looking at the CDC and the main CDC to really guide us on that and when that booster will be available. And as far as the kids, we continue to hear it's just around the corner, but have yet to see it. And so we'll just keep our fingers crossed and hope that one of these times it is there, and we'll just keep waiting and watching. JR, did you want to talk about that? Studies out of Israel?
Yeah, so the Israelis have gone ahead and done a lot of 4th doses, and they've got a really good healthcare system in terms of computer connectivity, so they can look at this kind of thing easily. And what they found is going from a 3rd to a 4th dose really didn't help much for most people. The one group it helped were the elderly, infirm, and immunocompromised. Now, we're already doing that somewhat. We don't call it a second booster. In this country, we say that if you are immunocompromised, that it takes you 3 doses for your initial series, and then your 4th dose is your booster. the CDC and the FDA looked real hard at the data last week and said it's not worth the very small benefit is not worth it, except in the people who are significantly immunocompromised, and I think that's quite reasonable. I am certain we will be doing another COVID shot in sometime months to a year or two from now. The interesting question is whether or not it will be a booster because people's immunity who had 3 doses are waning, or whether or not as further variants evolve, we'll have we'll get a new vaccine that's more targeted to the circulating variant. I mean, one of the things we know is this is how coronaviruses make a living, is by escaping immune surveillance and coming back to get you. Remember, the common cold, which we all get several times a year, more often if you've got kids, is a coronavirus that is just, it's not terribly severe, but it's really good at evolving to escape your ability to fight it. So we will be getting more shots. I'm guessing if you have normal immune system, many months. And on the news this morning, it said that Pfizer has said that it will be submitting this week, but whether or not when they actually submit it, and then how long, it's a 4-step process for approval, how long those 4 steps will take, or excuse me, for authorization, how long those 4 steps will take is a little hard to predict, especially for the sub-5s.
JR, when you described that, we in the US looked at it, so the FDA, the CDC looked at, is it the risk benefit analysis that you're referring to, as far as it really good for those who are immune compromised, but we're still just trying to get this wave of the first booster completed?
Yeah, I mean, the additional benefit of a 4th over a 3rd dose is relatively small, but it's a huge hassle for 200 million people. I mean, it's 200 million people have to take half an hour or an hour out of their day, and then to be honest, a lot of them are going to feel pretty lousy the next day, and it's not a risk likely in the sense of a terrible bad thing happening, but like I've said before on more than one town hall or school meeting, don't get a booster the day before you've got a major test at school, or the day before you're planning to compete in a marathon. It's just not gonna happen. Or for you, Chrissy, don't take it right before when there's powder predicted for tomorrow.
Exactly. Exactly.
So there's not a huge dangerous risk of a booster, but it certainly qualifies as a significant annoyance, as well as a big cost to the healthcare system to give 200 million shots. And right now it looks like if people were boosted, that's the big benefit. We have to put our energy into getting everybody vaccinated and boosted. And for the few people who are immunocompromised, a 4th dose, and if possible, Evusheld.
Yeah, it sounds that's what I was going to build on and unpack a little bit, especially with Denmark, right? If you've got 60% of your country boosted, you're starting to lift those social barriers. It certainly speaks to the topic we'll touch on a little bit later, is what does that crystal ball look like? So yeah, that's good information.
Do you have anything more to add as far as vaccines for children under 5 years of age?
That's a group that it will be good to get a vaccine, because they're actually at greater risk of bad COVID than school age kids. And I know there's a lot of parents, a lot of families who are very anxious. They're anxious about sending their kids to daycare. They're anxious about their older kids going to school because they're afraid that their 8-year-old will bring it back and give it to their 3-year-old, because the vaccine is not yet available. So there will be a lot of people who will sleep better once that is authorized. But I don't have any typically once the data has been submitted, like I say, the company has said they're going to submit this week, but it hasn't been submitted as of an hour and a half ago. I have not looked since then. As of an hour and a half ago, it had not been submitted. It will probably take a couple of weeks. And then the other thing we have not seen yet is whether we are going to be giving a smaller amount of the older children's dose, or whether there will be a special formulation. So even once it's authorized, then there'll be the distribution question for how soon it will be available for us to administer. Trevor may have information on that.
There you go. Just waiting to unmute. But no, we're really not clear on what I know they've been working hard on what dose to give those little humans that process medications much differently than we do. And so I think that's been one of the biggest challenges. And we continue to hear that's been around the corner. We've heard that. We heard it was going to be in November and then December. And we are hoping that they're getting closer, and that's what we're hearing. And so, there's talk that it could be as early as the end of this month, but we've heard that before. So we're just being patiently optimistic and looking forward to it, because I know I have an 18-month-old that I will gladly get her vaccinated and make sure that she's not spreading COVID around my house. So, and just that'll take care of everybody and have everybody a little bit more protected.
She is an adorable little vector.
She is.
Love our little vectors.
She's right over my shoulder here. So
yeah.
Now we have a question that came in from the live Q&A. I'm going to serve this up to whoever is willing to answer. Are home tests resulting in false negatives for Omicron, to your knowledge?
Yes, sort of.
Yeah.
So
I think that ball hit the net, but and tipped over. But keep going.
So yes, definitely there are false negatives, and there are two kinds of false negatives. If I said define what a false negative is, so there are frequently circumstances where a PCR will be positive and a home test will be negative. One of them doesn't really matter, and that's why the sort of answer. And that is that if you got COVID a week ago and you get a good swab and your home test is negative, or better yet, 2 home tests 12 to 24 hours apart are negative, you pretty much cannot spread COVID. And you are safe to go back to work. You are safe to go visit your kids, whatever. You would quite likely have a positive PCR, because the PCR is very, very sensitive. And so that's the time when you can get a quote false negative, i.e. the home test is negative, but the PCR test is positive, but it's really, to be honest, the home test is just as useful, if not more useful. The problem is if 2 days ago you went to the store and were around a bunch of unmasked people, and now you want to go visit your grandmother, you could have a negative COVID test by home method today, and by tomorrow you could have plenty of COVID, because you might have only a tiny bit of COVID in your nostrils because it's just started growing. Now, I'll give you a really simple way of looking at that. I am coming back from a trip cross country, and I am going to see my preemie niece and great niece and great nephew in Ann Arbor in a few days. Yeah, and they are one of them just got off oxygen. They're cute little kids, but they're not the strongest babies ever. I'm going to test a couple days in a row, and I'm going to be super careful leading into that. I'm not going to trust a single negative test after recent exposures, because if I was really early in my disease, I could get a false negative. So they're good. but they can miss early infection. And we now know from a very nice study done on Broadway theater workers, of all odd things, where they were getting PCR and rapid tests every day, that typically the PCR is positive 24 to 36 hours before the rapid test. So, and if you are sick and you've been sick for a couple of days, then the rapid test is really good. Because by then, if it's COVID that's making you sick, it should be able to be detected. That's assuming you do the test properly and it's a good quality test. If you do have tests at home that you've had home for a while, it's worth looking up to make sure that they weren't one of the brands that got recalled, because a bunch of them were sold that were not accurate. But that's a separate question. So make sure it's not a recalled test.
Thank you, JR. Our next question is for you, Chrissy. That was a bit of a tongue tie there. We have heard a lot about N95s and mask quality with the rise of Omicron. Should we be all wearing N95s or something similar?
So we also have put together a infographic that we'll be sharing with all of our business partners and our community as well regarding masking, but I'm just going to talk a little bit about, so as science evolves, new information comes out, and the CDC made some additional recommendations for mask adherence for the spread of disease. Masking has been prevalent in hospitals for years. And in hospitals, we use special masks that are fitted to our clinicians. So N95 respirator mask, or KN95 respirators, what they're called. These are all masks. They're specially fitted. So Dr. Krevans and Dr. Casey, they go to an expert in our clinical expert, and they get fitted for their mask to assure that the fit is correct. And those N95s that we use, they'll tell you they are not fun to wear all day. The fit is tight, but it is designed to stop the spread. So what the CDC came out and said, everyone should be wearing N95 mask. That's the highest level of protection. We're not arguing that. We agree with that. The supply chain right now, as all of you know, if you walk into any store, there's I would say 50-50 chance. Now I'm going to say maybe 10% chance you're going to get what you actually want and the brand you wanted when you walked into that store. The pressure on the supply chain is immense. So there has been some preservation that has been put in place to make sure healthcare workers who were at the forefront of fighting this disease had the first option and supply for N95s. And so now the CDC says, it was really good to protect with cloth mask and cloth face coverings, but those have really gone down the hierarchy as far as protection. So when we talk about N95s, we talk about KN95s, and we talk about KF94 mask. Those are the best masks to be worn if worn properly. And some really key things, which are really easy to do because we're really good at washing our hands now, is, you should have clean hands when you're putting a mask on. You should make sure it fits properly. Dr. Krevans, I'm going to say probably a year and a half ago, did a video about how to wear a mask with glasses. He taught me because I kept messing it up. And it's really about making sure that it fits snugly around your nose is covered and your mouth is covered. So having a tight-fitting mask, making sure it's properly adhere. A lot of times with these procedure masks, or ASTM3s, which give a good protection too, they're just not reusable. There is a way to store and take care of your N95s and N94s in a paper bag and let them dry out and reuse them up to, I'm going to say probably, JR, you said at one point it was 48 or 72 hours.
So there's, we were saying 2 to 3 days, 16 hours to 24 hours of use, but actually the CDC, some CDC experts have just said that masks can be worn for 5 work days. But I have not seen that data. Julian, and I actually want to give a shout out, by the way, to Julian Kufler, who's sort of my partner in crime, who's another geek who likes to read articles all day and see what's coming out there. He and I were actually in correspondence about this morning before the meeting. We haven't got updated actual CDC test results, but multiple experts are now saying that you can wear a high quality mask as long as it doesn't get saturated with moisture or dirty for 5 work days. Whether that's a N95 or an ASTM rated mask. And I will actually say one of the biggest differences between the medical grade masks and the ones that are not medical grade in the current manufacturing. And one of the reasons why the medical grade ones are a little harder to breathe through, but have to be reserved for us, is something which most of you hopefully will never need to care about. Medical grade ones are resistant to having blood splashed on you. And I hope that none of you in your daily lives are at risk of that. But I guess since I have one, I just want to show, this is a double bent. You can see I've bent it. This is a what's called a type 3 surgical mask, and I bent it backwards at the nose and bent the cheek pieces back. And then it fits my face very tightly with no leaks. I like this because it's, as a level 3, it's almost as good as a KN94, but I can wear this all day. Literally, sometimes I've been known to be walking across the parking lot and someone will say, "Why do you have a mask on?" And I'm like, "Oh, because I forgot to take it off."
I think Mary actually says, "JR, why do you have your mask on? I'm right next to you." Or put your mask on. I think it's important to build on what JR is talking about too. Is, ladies, let's just be honest. Ours get dirty. They don't last. We get makeup on them. You got to exchange these pretty much every day. That's not as convenient for some of us. So, but to JR's point, fitted correctly, you can cross loop these the strings around your ears to make sure it fits even better, because you want to make sure that you're fitting it around your face and nose. Molly has just put up our infographic that we are going to publish for everyone to have. Some key things we want to share with you. There are a huge amount of counterfeit masks out there. It is really important for you as a consumer to make sure the mask you are getting are durable and are certified. And in this infographic, there's some key things. There's actually a website that we can put you on, which will point you to, which gives you information about NIOSH, which is a certification about the integrity of the mask. We're going to put out a video that the CDC has put out, which shows you how to properly adhere a mask to you. We've done this, so what's best, what's good, what's fair. But there's on KN95s, there's a manufacturer stamp. It's down in the lower part of the infographic. And if your KN95 does not have that stamp on it or does not say NIOSH, it is a counterfeit mask, and it will provide you absolutely no protection. And it's very important. There's so many people out there trying to sell you masks. And of course you want to protect yourself and your family. Just be really cautious. And the one thing we know is before we had a vaccine, we were distancing and we were masking, and we were doing an excellent job of taking care of each other. So we want to make sure you have this information available to you. And again, it will be published out through our chamber partners, through the Down East COVID Task Force, as well. It will be on mdihospital.org in our coronavirus information hub.
Thank you, Chrissy. I'm going to go ahead and take this off for the time being, but the link to where this is posted on our website is already in the chat. So for anyone looking to read more on this infographic, feel free to visit our website and find the infographic there. And with our remaining time as a group, can you each respond to the question that's on everybody's mind? When will this be over?
Well, I think, we've teed up this conversation throughout our 56 minutes that we've had with all of you. And it really is about for me, I see that we can make this happen. I know as a globe, we have to make this happen, but as a country and as a state, we can make this happen. It starts with adhering to the vaccine regimen that are prescribed, and then it really is about making sure that until we get there and we have enough medications that can help take care of those who do have COVID, and we have prevention and prophylactics in place, then we're going to start to see this. I look at it like that dinosaur, Dino the dinosaur, and we're at the top of his back, and hopefully we're sliding down that tail and we're getting to the end. But it's going to take all of us to continue to really be vigilant and to encourage those things that will make this go away and become only an endemic and a respiratory disease. You're on mute, JR. You get the coffee cup. Here's your coffee cup.
So I would give a simple version of what Chrissy just said. Maybe a little different in some ways. People say, when is this going to be over? One answer is soon, and the other answer is never. The soon answer is, I think there's a really good chance with our current increase in therapeutic availability and the fact that so many people have either gotten vaccinated or gotten themselves sick in the last few months that, you know, across the country, we are seeing the rate of hospitalization starting to decline, that within some period of time, a month or two is my guess, the healthcare system will no longer be in crisis. We will no longer have people dying waiting for surgery. We will no longer have people dying by the side of the road waiting for an ambulance, which is where we are right now. And as a state and as a country, and that's not tolerable. But we're going to move away from that if we choose to. And so in that sense, within probably a month or two, it's going to be reasonable to relax a lot of these social controls on behavior, expectations of masking for kids, etc. And the never answer is, my son is in PA school. If he practices 40 years like I have, I expect at the end of his 40 years, he's going to be treating people for SARS-CoV-2, and it's going to be a bad illness because it's still going to be out there. And for people who are not vaccinated or as new variants arise that escape vaccines, this is something we are going to be facing as a society, as a species. This virus has jumped from the animal world to us, and it is going to be around. And that's just the nature of things. You know, this happens, and we have to be honest and deal with it. But it's not something we can't deal with if we choose to deal with it. If people who choose to say it's not true, people who choose to deny it, they're the ones who are going to die of it, and they're the ones who are going to cripple our society.
And I really don't have anything to add. I think it's gonna be something we deal with, and we're gonna continue to see additional medications come out that allow us to treat and continue to vaccinate on an ongoing basis. And I think it'll be like our flu vaccine on a yearly basis. Will be they're already looking at doing combination flu vaccines and COVID vaccines, and so there's going to be a market, and it's going to be something that we're going to be doing on a regular basis.
And I think for our community to know that we are actively looking at what that future looks like to ensure that we have the right respiratory environments, respiratory rooms in our primary care practices, looking at long haulers. How are we going to take care of COVID long haul? As a community, as a region, as a state, we haven't been really dealing with those questions yet. So we are investing time and energy into helping make sure as this becomes an endemic that we are here to care for the community close to home where you need your care.
Thank you all. That was our final question for the time available today. At this point, I'm going to hand it back over to Chrissy to close.
Thank you, Molly. Thank you all for your important questions and for joining us this afternoon. I'd also like to thank, of course, JR and Trevor for always being right here with all of their expertise and knowledge and to share that with us today. We want you to know how grateful we are to all of you and what you've done for this community, for each other, for our residents, for our team at MDI Hospital and Health Centers in Birch Bay Retirement Village, keeping this community safe and relatively free from the major impact of this pandemic. But it still remains, we have to stay vigilant. So our COVID-19 pandemic response continues. MDI Hospital is committed to providing that with evidence-based care, as much information and education, infographics that you can take. We're here for that, and all the support possible. So again, thanks for sharing a little over an hour with us today. We appreciate your commitment to health, and our commitment to community will continue to effort on and keep everyone healthy and vibrant. Stay hopeful, stay happy, and of course, stay healthy.